My name is Kenesha Barron, and I chose the SBIRT, or the Screening, Brief Intervention, and Referral to Treatment Service. The SBIRT measures the risk of troublesome drug and alcohol use by evaluating an adolescent substance use pattern to see who might benefit from some type of intervention or treatment based on their level of risk. This measure can be used for adolescents to help prevent or intervene with substance use or abuse. And I would personally implement this as soon as it becomes apparent that an adolescent is using substances. This can be used anywhere and in any setting. It is a questionnaire, and it can be used in primary care offices, ERs, schools, community centers, and telehealth. It can also be administered by social workers, counselors, psychologists, primary care providers, nurses, and health educators. The SBIRT, again, is a questionnaire that consists of 10 items on a scale from 0 to 10 for each question. And your score determines your risk factor. If you are low risk, if you score 1 to 7, and that means no intervention. Risky or hazardous is a score of 8 to 15, which may include intervention. And then a high risk is a score of 20 or higher, and that might include further assessment and intervention. It is pretty consistent and therefore reliable. So if one adolescent in a short period of time is administered the SBIRT by different administrators, then they should yield the same results or similar results. And it is an evidence-based approach using universal screening to help bring out individuals that could be at risk for substance abuse. The pros are that it is early intervention, cost-effective, it can help with mental health, and it can help with tobacco use. But the cons are that it has limited evidence for some issues, barriers to implementation, confidentiality issues, and resource constraints. Good afternoon. How are you today?
Doing good.
So it was brought to my attention that you have been using substances.
Not a lot.
Not a lot? Okay, so I'm going to give you something called an SBIRT. It's going to be a questionnaire. I'm going to need you to fill it out. Each question, it's going to be on a scale from 0 to 10. Each question, 0 being nothing, 10 being the highest. And then I'm going to measure your score, and then we're going to go from there, and we're going to see your results. And if you're a low risk, a risky or hazardous, or if you're a high risk, and if you need any intervention or not. Does that sound good?
Do I have to do it?
Yes, this will be, no, you don't have to do it, but it would help just to see if you are risky or not, and just to see if we can help you with your substance use so that this doesn't develop into a further problem in the future.
Fine, I guess.
Okay, thank you. Once you're done filling that out, I will go over your score with you, and we'll go over your results, and then I will tell you what our next steps will be.